Congressman Michael Arcuri held a town hall meeting Wednesday to discuss the controversial health care reform bill. The IT Theater at MVCC was packed to capacity as more than 400 constituents of the 24th Congressional District attended the town hall meeting. The meeting was conducted by two moderators whom selected random people from the audience. Each speaker was limited to 2 minutes and 30 seconds to make their statement.
Congressman Arcuri is my congressman, and I'm really pleased that he's wrestling with this very, very important decision. And I feel so strongly that this is the moment when we simply have to do the right thing and cover the American people with health insurance. This is it's ruining small businesses in this country. It's ruining people's lives that they have to worry about whether they're going to have health insurance. My daughter has a pre-existing condition. She had to move to Massachusetts because at least she could get some health care there. My twin sister has MS. She was just laid off from her job where she'd worked 15 years. She's got, because of the stimulus plan, she gets part of her COBRA paid for. It's the only way she can afford it. When she goes off, when that runs out in 6 months, she's looking at $3,000 a month for medications to keep her alive. Now, that's insane.
I've been trying for weeks to get to talk to Arcuri, and he refuses to answer phone calls, respond to emails. I can't even get a personal meeting set up with him.
Now, I see you're standing outside during the town hall meeting. What happened?
We waited in line, and they closed the door on us about 20 people before it was our turn.
Now, what's your major concern with the health care reform bill?
My major concern? Well, number one, there has to be a problem. If it's not good enough for them, then it's not good enough for me. Why are they above the law they want to give for us? That's just wrong. They work for us. No employer gives their employee better coverage than they give themselves.
You said you'll take the public option?
I would support a public option if it's the right public option. I mean,
and you'll take it for yourself?
And I will take it for myself, absolutely, if we have a public option. I will take the public option. I'll support an amendment that says that the members of Congress have to take it. But if they don't, I'll take it for myself anyway.
Well, we're here today because we want to make sure that healthcare reform is positive, that it includes women's health, including reproductive health care, that women at the end of the day aren't worse off after healthcare reform is passed. Oftentimes, Planned Parenthood is the only healthcare center that these women can turn to for their reproductive health care, but also annual exams, blood pressure screening, testing, and things like that. So we're a community health provider, and we want to make sure that women's health is included in healthcare reform.
Now, do you think that the cost of abortion procedures should be covered under the health care?
You know, there's a lot of discussion about that. Obviously, it's a very heated argument. It's so much more than abortion. It's about preventive, it's about STI testing and treatment, it's about prenatal care, it's about the WIC program. So I think when we get bogged down by that one particular issue, it dilutes the whole subject.
I came down because I wanted to try to hear what Mr. Arcuri said, and I also wanted to try and voice my opinion about the current healthcare reform debate.
What side are you standing on right now with the health care?
As it stands, I'm against it.
And why would that be? And what would you like to see change?
I've actually read the bill. I actually spent the time to go through it, and there are a lot of things in it, though it's noble in its scope. There are too many deal breakers for me. Higher taxes, mandated coverage, which I think is almost unconstitutional, forcing people into situations. It creates a burdensome situation for small to middle businesses that ultimately may not be able to afford to cover these people. Ultimately, it's creating a larger scope system, and it's almost a power grab for the government. While it's noble in its overall scope, I don't think it's tenable in its current situation. If we were able to pare it down, if we could get the deal breakers out, I would be able to support it.
I want to thank you for coming to this forum because I think this is extremely important that we can share our views about this very important thing. We're going to try and transform approximately a fifth of the private companies in this country and put it under government control as far as I can see in this bill.
Well, my views is I'm out here today to support Healthcare for America Now. And we really want to see healthcare that's affordable to everyone, that has a strong public option, that allows people a choice between keeping what they've got, but also an opportunity to join a public option, which we feel is critical to keeping the private health insurance industry in check, because they've been able to deny coverage, raise premiums over, tens of, times over in the last, 10 years, and it's becoming unaffordable. So we believe a public option will be able to control costs, will keep the insurance industry more honest, and will stop them from denying care, denying coverage, and raising their prices. Yeah. How you pay for it is basically the whole concept of everyone pays into a system. Right now we're paying astronomical costs for health care.
And who's going to pay the money? Where's the money coming from?
We all pay. We all pay based but at a crazy rate. We all pay the same rate, whether you're a millionaire or
it's
not.
Open up. Everybody can buy their insurance from anybody, not just what they offer you in this state.
No, but
not that way.
Yes, this would give. Actually, it creates an exchange that allows people to go. You can choose any private option you want, or you can choose a public option.
You live in, not across the country. If they opened it up where everybody got a chance. They only give you certain options in this state because somebody's got to pay for that. The government. Where's the government getting it?
Mario Cuomo once said that the federal government should only involve itself in situations that they need to provide that individual states can't. Thus, our government supplies the Army that defends this nation. They don't seem to have a problem sticking their nose in our business, protecting us there. I don't have a problem with the federal government saying that my health and my well-being, as promised in the Constitution of the United States, is how you define life, liberty, and the pursuit of happiness. I don't have a problem with the federal government getting involved with paying for my health care.
It is not broken. It is not. There may be a few people, right now, there are some people straining the healthcare system because everyone goes to the emergency room. Even when they, because you know why? Government came in and said, you can't deny someone in the emergency room. So in other words, even if it's not an emergency, they can't go down and say, no, you need to go to urgent care. They have to treat them in the emergency room for something that isn't even an emergency.
That's dialectic materialism.
I was very proud of the way the meeting was conducted, and that's by my constituents. I mean, they were, they asked. There was a lot of passion in the room, which you like. That's great. But there was also a lot of respect. Obviously, some people got a little excited, but when you're talking about something that stirs this kind of passion, obviously it's going to happen. We've been trying to do a number of different meetings with people in a number of different ways.